Good morning, everyone. I'm Jess. I'm here from the cheer team, and we are going to get started in just about a minute or so. We're waiting for some folks still to enter. We're so glad that you're all here today and are excited to get started on this workshop. Okay, we're going to go ahead and get started. It's 11 o'clock now, and we've got lots of great information for you today and speakers who are joining us. So we're going to go ahead and get started. Today we are focusing our workshop on an introduction to community engaged research, what, why, and how to get involved. We are recording this session, just to let everyone know. Next slide, Jen. Okay, so to introduce the cheer team to you, we are the creators of this slide. Our program is CHEER, the Community Health, Equity, and Engagement Research Team. I'm Jess Schroedel. I'm a project manager for our group. I'm joined today with Paula Moody, who is also a project manager, Andrea Murray, who is the Director of Community Engagement, and Jennifer Posier, who is our Director of Education. We're so glad you're all here today. We're just thrilled to have you here, as well as our guest presenters. We have hosted previous workshops and asked you for feedback of topics that you're interested in, and we are listening. This is how we came to our presentation today, our topic for today, and we will be offering an evaluation that we hope you will complete after our presentation today, that we can plan future workshops based on your interests and your needs. So thank you again for everyone. So we'll go ahead and get started. Next slide, Jen. Our guest presenters today are Dr. Van Scoy. She is the Professor of Medicine for the Humanities and Public Health Sciences, co-director of the Qualitative and Mixed Methods Core at Penn State, director of the Project Talk Trial and Communication Lab, and the Parker B. Francis Research Scholar, as well as Dr. Lenny C.K. Marshall, who is the Director of Diversity and Inclusion for the Big Bend Hospice, and he is representing our community partner, part of a community engaged research project. So Dr. Van Scoy and Dr. Marshall will be here today to talk about their partnership in an actual community engaged research project. So we're so thrilled to have them. We're actually going to put in the chat right now also an additional link that will give you more detailed information about Dr. Van Scoy and Dr. Marshall's backgrounds. There will also be information about all of our attendees today and the organizations that are represented. So I think Paula's going to go ahead and put that in the link now. We can go ahead to the next slide. Logistics wise, just real quick, some housekeeping information. The presentation again is being recorded today. If you do have questions, please just use your hand feature in the Zoom so that we can get to you. The chat, we encourage everyone to please use that as a way to communicate with others attending today, make comments, share resources. We hope this can be as interactive as possible. Just to let everyone know as well that the materials that are being presented will be shared with everyone post-session. So we will send out an email not long after the conclusion of the workshop today with all of that information. Okay, thanks, Jen. As far as the agenda goes, just to let everyone know the quick rundown of what we're looking at today. First, we're going to go over some basics about the fundamentals of what community engaged research is, the what, why, and how to get involved. Then we're going to do a small group activity. And then we're going to have our guest presenters, Dr. Van Scoy and Dr. Marshall, talk about their partnership working together in a community research project. And then finally, we'll end with question and answers. So thank you. And Jen, you can go ahead and take it away. Oh, I'm sorry. You know what? I have the learning objectives and goals. Sorry about that. We also have 2 objectives for today. Our participants, we're hoping, will learn what community engaged research is and how it benefits communities and community partners. And we also would like everyone to be able to identify steps to get involved in community engaged research. So now I'm going to pass it on to Jen, and you can go ahead and get started. Thanks so much.
Thanks so much, Jess, and welcome everyone to this session. We're thrilled to have you here. we're going to be just spending a few moments talking about the fundamentals of community engaged research, really what it is, why we do this, why it's important to have this approach to research, and then how really you can get involved at Penn State. And we know from our registration that there's both faculty and research teams on board, as well as many, many wonderful community partners. So we really welcome you all and appreciate you taking the time to join today to learn a little bit more about this and how you can have some really wonderful partnerships across our university and within our communities. So really wonderful to hear also a little bit later today how this actually can be facilitated in action through the wonderful partnership that you'll learn about. So first off, what is community? And this was a question that we asked, if you can remember, through the registration. We had a question about, what does community mean to you? You can just list some names or phrases. And this is what you all wonderful thoughtfulness came up with. So you can see here through this word cloud, it's a beautiful display of the very many definitions of community. We know that community doesn't mean just one thing. It can mean a lot of things to many different types of people. So this is something that we really appreciate you engaging in and offering your feedback on. You can see here that there's lots of different definitions of community. And so when we look at traditional health research, we see that it's really not set up very effectively to benefit communities. When we think of research, in the traditional model, there's researchers kind of working in silos, not really working together with the various groups that care about the research. And so research is really being conducted on the community rather than with the community. And so community engaged research is kind of flipping that script a little bit and saying, how can we partner with the community to really have this transformative approach to research that's grounded in these principles such as community empowerment, collaboration, and social change. This is linked to a YouTube that we did send out in our registration email. We'll make sure that's in the follow-up materials as well. It's a really great whiteboard video that was developed to pretty much explain what community engaged research is in less than 5 minutes. So there was a team of students at the University of Toronto that did a really beautiful job with it. So feel free to check that out if you haven't. But we're going to spend a few moments talking about, look, what do we really mean by this concept of engaging with the community? And it really means that it's forming partnerships with those that are on the ground, really knowing what those true community needs are so that we can really partner to understand and prioritize research that is going to really help address the most important questions that the community really needs to have addressed and that they care about, and really driving those issues that are important to the community. So when we talk about all the wonderful community partners we have, and so many are represented in the room today, it can be referring to lots of various stakeholders. So patients and caregivers can give their really wonderful lived expertise on a particular condition or illness that they're experiencing or taking care of those patients that are experiencing. We also have wonderful partnerships with community-based organizations, coalitions. Clinicians have a vested interest in research and really can provide wonderful insight into what they're seeing in practice to help inform the research. Certainly policymakers as well can really help drive decisions on a policy level as a result of the research. Advocates, industry representatives, subject matter experts, and really the list just continues on and on. Our community partners come in all shapes and sizes, and we welcome everyone who has a vested interest in the research to participate because there's always a role and a way to get involved. And so when we think of the various ways that you can get involved as a community partner, we know that it can range from project to project. Sometimes it's minimal involvement where it's not as intense and you're just kind of providing sort of a consultation perspective, providing some feedback at various stages of the project. Or sometimes you're really actively engaged in those research phases. So we've had community partners that have helped with recruitment, data collection, even data analysis, and perhaps most importantly, the dissemination of those findings back out into the community. So it really just depends on the project, and it can, one interaction or collaboration can really serve as a springboard for a more involved collaboration moving forward. So why do we do this type of work? Why is it important to engage the community, not as just participants, but actually as real drivers of the research? Well, it turns out that it results in meaningful and relevant research so that, we remove those silos, we break down any barriers, and we answer the questions that are really important to the community so that there's going to be a better uptake of those findings. It also helps improve recruitment and retention. And so we know that recruitment and retention can be kind of tricky, especially in central Pennsylvania when we're trying to address health disparities and overcome some stigmas associated with research. We know that our community partners really have that trust built already within the communities, and we can leverage those partnerships and those connections that they have to really get the word out about research and also help the community feel comfortable participating in the research because they know that it's something that they can contribute towards that can help overall population wellness. It also can increase translation. So by leveraging those community partnerships and their various broad and far-reaching networks, we can really disseminate our results not only to the scientific community, but really to the lay community. So those results get back into the hands of those that need it to make informed healthcare decisions. And then finally, really just this underlying benefit of improving trust in research. So if we can partner with community members and remove that stigma from the past historical atrocities, it really can just benefit research in the long run in terms of partnerships moving forward. But then how does also community engaged research benefit community partners? Because we do want to emphasize that this is a very synergistic relationship and that we're not just, again, tapping into the community to get what the researchers needs. It's really this mutual beneficial relationship that requires bidirectional learning and bidirectional communication. But really the community partners can benefit as well. And it's an opportunity for them to build out their partnerships and their networks, to share ideas with not only the research team or the academic side, but also the other community partners that are part of the project. And so this can lead to future funding opportunities, future professional opportunities. Also, it provides the community partner with a platform to share key aspects of the community that they serve. And so what those specific needs are, it provides them with an elevated voice to kind of make changes on what those needs are by partnering on the research. And then again, opportunities for professional as well as personal growth. So this could lead to future funding, individual acknowledgements, agency recognition and trust, and also research impact, knowing that the research really wouldn't have been possible without those wonderful partnerships. I'm going to pass it along to my colleague Paula, and she's going to walk us through a small group activity now. So you can start to think about, this concept of community engaged research if it's new to you. If it's not new to you, thinking through sort of what those challenges might be. So go ahead, Paula.
Good morning, everyone. Excuse me, I'm Paula Moody. I'm one of the research project managers on the CHEER initiative. Welcome to our workshop this morning. We're going to break you into smaller groups and give you a chance to get to know each other a little bit better. The purpose behind this small group activity is really to give you a chance to talk about some of the challenges you face in your organizations that may ultimately benefit from having researchers involved in you addressing those challenges. We are aware that there are some researchers on the call today, so please take this opportunity if you are a researcher to share with some folks in your small group who may be community partners. Share your research interests because the idea is hopefully there may be some overlap and that this particular workshop will build some connections among folks in the community with you and your research interests. So Jess, my colleague here, is going to break you into some smaller groups. We would please ask you to just introduce yourself, introduce your organization, and as the slide suggests here, to just speak among the small group members about some of the things that you face as challenges within your organization. Or again, if you're a researcher, sharing some of your research interests and hoping there would be some overlap. We'll reconvene and then kind of share in the chat some of those topics for future discussion.
Okay, thanks, Paula. I'm going to go ahead and break everyone out. You should have 3 or 4 participants per group. So I'll go ahead and do that now.
Welcome back, everyone. We hope you had the opportunity to chat a little bit with folks in your small group about some of the things that you experienced as challenges, or perhaps you got connected with a researcher that could share some interests with you. One of the things that we like to do as a CHEER team is foster conversation after our educational sessions. One of the ways we would like to do that as a follow-up to this particular session is to share those challenges where there may be opportunity for collaboration among community organizations and researchers. The way we would like to gather that information, if you're comfortable doing so, if you would include in the chat some of the challenges that you have faced as a community organization, or some of the topics of interest that you wish to explore as a researcher. We as a team will then collect that information and share it with you in our post-session materials. So if you would like to include that information in the chat now, we'll kind of synthesize that information and hopefully give you the chance to work together in future opportunities, with similar interests. So we hope that you would share that, and we'll collect that information, put it together in a nice, pretty package for you in our post-session materials, and allow you to continue the conversation. So thanks. So now I'm going to turn this over to my colleague, Andrea, and she will share with you a little bit more about what we as a team in our CHEER initiative are all about. And Andrea, you can take it away. Thanks.
Thanks, Paula. So just wanted to talk a little bit about how community partners get involved in community engaged research. So as you're putting these thoughts into the chat over here about what you talked about in your groups, how do you as a community partner now get involved in this whole process? So, the first thing is us, CHEER. So the Community Health Equity and Engaged Research Core. One of our goals as the CHEER group here is to, create access to researchers throughout multiple disciplines here at Penn State University who are interested in improving wellness and reducing health disparities in the communities that surround us. And so while, I say here at Penn State University and we talk about Pennsylvania a lot, there's a lot of other community partners that we join with that might not be in Pennsylvania's either. And, if you are one of those, we're not leaving you out here. So, thinking about the broader area too, and you'll see that and later on our researcher actually is partnering with a community partner outside of the state of Pennsylvania. And then also, there's also a lot of other universities, including universities and college and academic partnerships that have groups like us through their clinical and translational science institutes and, other universities that do community engaged research. So just doing a search online for colleges and their respective academic departments that might align with the challenges that you're seeing would help a lot too in finding some community engaged research projects to move forward with. And so as we look at the maps that we see on the screen, last April, many of you that are on this call today may have taken part in a survey that asked a little bit about being a part of community engaged research. Researchers, we asked who they were partnering with. Community partners, we asked if you were ever involved in community engaged research. And you can see over the time period here, back in 2018, we did a similar survey, and then this one now in 2020, you can see the growth in community engaged research through Penn State University here in the state of Pennsylvania. And so we just want to know, with seeing all these great things coming in through the chat here, we're looking to keep this growth going in community engaged research. And you'll learn a little bit about the importance of why researchers and community partners need to work together as we move forward with the presentation. And then if we just want to go to the next slide. Thanks, Jen. So what are our key goals of CHEER here? And so I really want to put this into the lens of a community member. We want to make sure that we're maintaining and updating our databases of community partners and researchers who are actively engaged or interested in community engaged research. Why do we want to do this? Because there's at times when we find that there's funding mechanisms that can be utilized to uplift the thoughts that are from our researchers and our community partners. And so we want to be able to reach out to you guys and say, hey, we have some opportunities for you to work together. And then we also just want to keep a pulse on what's going on. We know that there's a lot of different disciplines here at Penn State University that could be helpful to our community members. And so knowing what the community needs and what the researchers are interested in is really important to us. We want to facilitate that matchmaking between community partners and researchers. So if you're a researcher on this call today, you can get a hold of us here at CHEER. And if you're a community partner and you think this is really fascinating and you're putting these great things in the chat and you're like, I really like to talk to somebody who researches this, you can also contact us, and we get to play fun matchmaking in the sense of finding the right people to connect with each other. And then providing educational programming like we are today, and resources for community partners and researchers new to community engaged research, and offer continuing learning opportunities. And so as my team members were saying, you know, we're going to ask you questions. What do you want to learn about? What do you need to know to make these partnerships and community engaged research really rise to the top? And make sure that our community voices are being heard when we think about research and how we disseminate and translate that into the public. And then also just creating pathways for sustaining engaged partnerships. So we're going to partner you up, we're going to introduce you guys, but then we got to make sure that we keep on engaging with our community partners. We want to talk to you. We want to talk about what the research looked like at the end. We want to give you updates about the research. And we want you to be involved every step of the way. So just maintaining those partnerships is really important as well. So without further ado, I have the opportunity to introduce Dr. LJ Van Scoy and her community partner, Dr. Lenny Marshall. They're going to talk a little bit about their community engaged research project and how these two created a great partnership to move forward research that was being done here.
Great. Thanks, Andrea. Hi, everyone. My name is LJ Van Scoy. I'm a pulmonary and critical care physician and researcher at Penn State. And I am really honored and excited to present the partnership that we have built with the Hospice Foundation of America and the University of Kentucky and other organizations across the U.S. to do research in a large randomized controlled trial that we call Project Talk. So if you want to go to the next slide, since I know not all of you are going to be familiar with advanced care planning, I want to give a quick 2-second overview of what advanced care planning is and is the topic of our research. So we do work on trying to get patients, family members to talk and think about their end of life preferences, priorities. What are your values? What are your goals? And what type of care would you want if you were very sick and were unable to speak for yourself? And the process of preparing for this is called advanced care planning. So this is a behavioral process. It's an ongoing process where people talk about their wishes and then complete advanced directives that specify their choices. Next slide. Go ahead. Unfortunately, there are many health disparities in this area related to the end-of-life delivery of care, and less than 25% of African American and Hispanic populations have completed advanced directives or engaged in advanced care planning. And so that's why we really take a community-based approach to try to reach difficult to reach populations so that we can help to eliminate some of these health disparities. Go ahead. So what our research is designed to do is to learn how we can engage people in communities near and far in advanced care planning, how to leverage our connections to reach underserved communities, and not just to get them to complete these behaviors, but how to stimulate meaningful conversations. Go ahead. So I have been so delighted to work with a wide variety of community partners over the years, and have really found that particularly with health inequities and disparities, community engagement is really the best way to advance research, particularly in our area, which is, you know, a pretty difficult conversation. Nobody wants to talk about death and dying. So incorporating the voice of the community and fostering these environments where they're safe and trusting by partnering with communities has really been effective for our research team and has given us opportunities that we would not have gotten otherwise. Go ahead. So quick overview of what we're doing and how we're doing it. Next slide. The Project Talk trial is a randomized control trial, which means that we have 2 intervention arms. One is a starter guide that's called the Conversation Project, and its goal is to get people to talk about their wishes and complete advance directives. The second intervention that we're researching is a gamified approach to the same issue of advanced care planning called Hello. And the Hello game is something I've been doing research on for quite some time and is very effective in motivating people to talk with loved ones and family members to get them to advance the process and do advanced care planning. And then we also have a control arm, which is similar in a drug trial, what we would call a placebo. And so a placebo in the behavioral sciences is what we call an attention control. So we have people play Table Topics, which is a game that's not about advanced care planning. And our hosts, when they enroll in our project and partner with us, they are going to sort of get a free-for-all of, they get randomized to one of these 3 interventions. And so our community partners are very dedicated to advanced care planning, but also to research. And so we will randomize them to receive one of these 3 interventions, which they then will help us to deliver in their community. Go ahead, next slide. So the way that we do this, this is really our secret sauce, which is really, I have to give a lot of credit to the Hospice Foundation of America that has a huge, they're a national organization, they're an educational organization. They don't deliver hospice services, which is end-of-life care, but they focus more on education and providing resources for hospices and other community members in this space. And by partnering with HFA, Hospice Foundation, we've really been able to access their network that they've built up over the years. And through HFA, we recruit what we call host organizations. And Dr. Marshall will share with you a little bit about his experience as a Project Talk host. But what the model does is, instead of, Big Bad Penn State going out into the community and us trying to, recruit and communicate and talk with cultures and folks that may not have as close trusting relationships with an organization like Penn State, we really communicate through the host, who can help us to sort of access the needs of the community, to understand the communities better, to deliver the sorts of things that these communities need, but do so in a way that's also culturally sensitive, but also allows us to conduct rigorous research in the form of a randomized control trial. And so we enroll hosts and they go out and they find community centers where they're going to have our events. And those are the community centers. And then the hosts actually do the recruitment for us, in the sense that they invite people to attend events that we set up. And the people who participate or who attend these events then can be eligible to participate in research if they choose. And so that's how we really meet our potential research participants. Go ahead, next slide. So we've been doing this. We're in year 2 of our project. I'm proud to show our map, which is filling out across the U.S. Our goal is to have at least one event in all of the 50 states. We are making our way across the country. We have 75 events planned, and we're almost halfway done. And so we're really looking for partners out in the Midwest, in the Western areas, in the Southwest as well. And you can see the green are completed events, and the orange ones are those that are coming up very soon. And we have a research team that travels to each of these sites. We send 2 research assistants to help our project hosts to put on a great Project Talk event and help us collect our data. Next slide. All of our hosts receive training, and that's really important to us as researchers, because fidelity of the intervention is very important, that the intervention is done the same way at every location. So we have manuals and procedures that allow for flexibility, but also make sure that we are maintaining the highest standards of research. And so we do provide all of our hosts with 4 hours of online training, with things from how to conduct research. Even though they're not technically conducting the research, we still want them aware of sort of the principles and the concepts that you see on the slide, but all the way through to the end of the event. And so we make sure that everybody has adequate training when we provide that through a host portal. Next slide. Then the hosts go and find us venues that will be appealing to their participants. And this is really super important, because we want to meet people where they are. A lot of our events are at community centers or places of worship. Next slide. The three interventions that we're working with, one is a workbook presentation, which is really run by the host, where the host guides their participants through a PowerPoint and a workbook that gets them having conversations. Next slide. The second intervention is a game where people play in small groups and are guided through important questions and play this really engaging game. And then the third, next slide, is the table topics game, which is the control arm. And for all of them, we also give them nutrition handouts and advanced care planning handouts so that we can collect data about which of these interventions is most successful at helping patients to be better prepared for end-of-life decision-making. Next slide. Part of our project is making sure that we provide the hosts with everything that they need, because we know how difficult community engagement is and how hard it is to create marketing materials for every event that you do. So we have templates that they can modify and download from our portal. Next slide. And then on the day of the event, the hosts really are running the show. It's with regards to, they have sort of a script to follow, and they help be the face of the event and welcome their guests into the event. But our research team is really the one that handles all the research procedures. So we collect data on the day of the event. We have some follow-up phone calls 2 to 4 weeks after the event, and then 6 months after the event, we collect data as well. And for each data collection point, our participants who opt in to participate in the research receive gift cards. And so they get $25 in a gift card for each sort of data collection point that they participate in. And so that helps to incentivize us and helps us collect the data that we need. The last thing that I wanted to mention is that we also do, our hosts themselves are research participants. It's so important that we get feedback from folks about how their experience was. And so we do one-on-one interviews with our hosts 2 weeks after the event. I should also mention that our hosts receive $300 stipends to help with marketing and food and everything they need to sort of, do the printing or whatever else is needed for the event in order to facilitate that. And then we get feedback from them at the end. This is our amazing team. It's a big team. It's a growing team. Unfortunately, we don't have everyone on the slide, but this is really a result of a huge partnership with Penn State and Hospice Foundation of America and others. You can see our team of research assistants and project managers that travel to these events. They're constantly living out of suitcases to go to these events and help hosts put on great efforts and also reach these communities that we really would never at Penn State be able to access or reach or provide materials to. So it's really a great team that we have. Next slide. And so now I'm going to turn it over to Dr. Marshall, who hosted a very successful event for us in Tallahassee, Florida, not too long ago. And I'd like for him to take over, and you can go to the next slide. I think we have some photos of his event, and he can share a little bit about his experience as a Project Talk host.
Thank you, Dr. Van Scoy, and thank you all for attending this most important workshop. I'm so excited to be part of it. As you all discuss research and connecting to community, I am Dr. Lenny Marshall. I am the Director of Diversity, Equity, and Inclusion here at Big Bend Hospice. We're a fairly new department here at our hospice, and my passion in serving as the director is I have a passion for access to of healthcare resources to minority communities. So when we linked up with Project Talk, and I also serve as a pastor as a backdrop there. When we think about the connection we made with Project Talk, I'm very grateful for the use of technology, because that's how we found out about being a part of this. And through the advertisement, through the various media outlets that we have, and so we applied to be part of the project and the research, and we're so glad that we did, because, like I said, I indicated earlier, my hope and my goal in the position that I serve is to make sure that we're getting this information, particularly for me in healthcare, to minority communities, communities and rural communities who might not have access to it. So we connected with Project Talk. We went through the application process. They chose us to be one of the host sites, and we hosted an event. We hosted the Conversation Project, where we used the material that was sent to us to have a conversation about advanced care directives. And we're so glad that we had this particular part of what was being presented to us to present to the community, because of COVID, we were so disconnected. We were so used to meeting on Zoom, and just being apart. So when we started to kind of loosen the guidelines about meeting in person, this is a great segue for our community people who we have not seen in a while to get together in person. So it ran right in line with what we were being asked to do. So as far as recruitment, when I started to get the word out to the communities, and I serve as a pastor in a rural community in an African Methodist Episcopal church, and the majority of my community is minorities. And when I started talking about advanced care directives, I was not amazed or shocked at the lack of information that was getting out to our communities about the need to talk about advanced care planning. So it wasn't a hard sell to get our community members to come to this event, to learn. Our communities are always anxious and always willing to learn about ways that they can take care of themselves in different areas of health, and advanced care planning is a big part of that. And so when we presented this project that we were going to do, it wasn't hard to get the number of people that we had. We had between 30 and 40 people to come to the event. I hosted it at the church where I pastor. So those pictures are our fellowship hall. It was a good venue, a lot of space, a lot of opportunity for people to come to gather together. Now, we believe that in order for this project that we hosted to be successful, there had to be a level of trust that had to be established within the community. And me being a part of the community and an identifiable face of the community, it wasn't hard for those who participated to have a sense of trust and about why they were participating in the research. I think that is so essential whenever you talk about research. And I shared that with the people that I were in the breakout session, is that trust to me is the key element to making any kind of research project successful. And it takes time to build that trust. So it's not an overnight thing, because you have to build relationships. Relationships build community. Community builds unity. And then when you talk about research and you talk about finding out the needs of a community, once you have that established trust, that research tends to go much more smoothly, which was the case for the event that we hosted. The people knew each other in the community. They were there at the table, and they were having honest discussions about what they wanted at the end of life. How powerful was that? Because they never had the opportunity. They never knew about the importance of advanced care planning, but through Project Talk and through the layout that was presented to us in the form of a PowerPoint and the slides that were presented, and this is how you can present it. Now, they presented me with a PowerPoint, but I framed it in the way that the community would receive it. So it wasn't like a cookie cutter. This is what you use. You frame that presentation to the way that you know that the community can relate. And so being a pastor, and let me just say this, if you're going to do this kind of, you have to be comfortable speaking in front of people, because you want them to engage, but you have to be comfortable in engaging them with what comes up during the conversation. So all to say is that it was very successful. The people walked away with information. They had advanced care directives available for them to complete. I like the fact that Project Talk is going to follow up with the participants to see where they are, because this is an ongoing thing. As you all know, as researchers is not a one snapshot day where you just, take a tally of who attends, but you have to follow these people. And I like the fact that they're being followed. And as a result of this presentation and a result of this great community effort, it was really good because people had an opportunity to share their thoughts. It has spread throughout other communities. So even after this day, other communities have reached out to us here at Big Bend Hospice, my department, and saying, wow, I heard that you had this project talk come and talk about advanced care planning. Can you bring that to our community? Can you bring that to our place of worship? Right. And so I'm very grateful of the fact that we were chosen. Totally a good experience. And I'm not short of words of talking about it because it was so powerful and impactful into communities. And what is research really intended to do? To make change, to make it have an impact. I'm sure we don't all do research just to look at the numbers. We all do that to see where we can do better, where we can have improvements, where we can serve our communities. So thank you so much, Dr. Van Scoy, for partnering with us. And thank you all for listening to my brief presentation.
Okay, well, thank you so much. We can see that Dr. Marshall, it looks like we have questions, some information there. If anybody wants to talk to Drs. Van Scoy or Dr. Marshall about their project, that information is listed right there. We're going to go ahead and segue into a question answer period. We have a few minutes for that. So if anybody does have some questions for Dr. Van Scoy or Dr. Marshall or any of the presenters, Jen, Andrea, or anyone else who's talked today, by all means, go ahead. You can put it in the chat, or you can go ahead and raise your hand in your Zoom discussion box. We'll try to get to you. It's probably best if you don't mind typing them in the chat. That would probably be the easiest way for us to get to you. I personally have a question, if you don't mind me asking. As you were talking, Dr. Van Scoy and Dr. Marshall, about your amazing work together in the community, I'm just wondering, what were some of the barriers that you found, and how you were able to overcome them in your project, as far as working in the community and perhaps with participants and things of that nature?
Well, thank you. And thank you for the question. Great question. And like I indicated during my brief presentation, I think one of the barriers that researchers may find, not so much for us, for me, being part of the community, is anytime you talk about research and you bring it into a community that does not know you, there's an element of trust, right? People to participate in research have to know what the research is for. The barrier could be that the trust element, where we don't know what exactly you're going to do with this research, where they play a part in the research, or the importance of them participating in research. So I always fall back on this. When it comes to the barrier, the biggest barrier to me is the trust issue. You have to take time to build relationship with the people you're doing research on. You can't just present research and say, this is why I want you to participate in this, and they not know who you are, what you stand for, what you're going to do with the research, because that's important to people, is that, and the importance of them being part of the research. And that all segues back to the building of trust. But trust takes building relationship, and it takes time. And so I think that that's the number one barrier. And then in the incentive, another barrier is the incentive to participate. With Project Talk, there were gift cards available to those who participated. So, there was a reward, so to speak, of coming and presenting. And so you have to bring something to the table whenever you talk about research in order to get something back. And so those barriers could be that you're not investing enough in what it takes to do the proper research, or you're not speaking to the community about what they would like to see research on. And once again, that goes back to the building of trust.
Thanks so much, Dr. Marshall, for that really thoughtful answer. Dr. Van Scoy, did you have anything to add?
Yeah, I mean, I think I 100% agree with Dr. Marshall. I was actually talking with our team this morning about how that community-based delivery model, that slide that I showed with the us and then the hosts and then the venues and then the participants. I mean, that really is like the heart and soul of our research project and has allowed us to overcome some of those barriers because the reality is that, if I wanted to go and disseminate resources in Tallahassee, Florida, I wouldn't even know where to start. And also gain diverse perspectives for our research so that we're making sure that we represent communities that are generalizable across the US. And so without having those community trusted hosts, none of it would work. The other thing that we're learning as we go is like, right, like for some of our events, we have Spanish speaking events and we've been relying on translators for that. And unfortunately, right now we don't have a Spanish speaking member on our team. And that's a real barrier for us because it really does lengthen the event. It, I think, has some issues to do with, trust and, if we can't speak the language, it makes it difficult for us to get our work done and our message across. And so, making sure that we have those sorts of connections are things that, those sorts of inlets into the communities, I think speaks very much to the trust as well.
Wonderful. Thank you so much. Those are really excellent, thoughts to have about the kind of barriers that we might face when we're doing these kind of partnerships. And coincidentally, actually, the cheer team is going to be putting together a workshop specifically about addressing these barriers that I'm going to announce that in just a minute or so. We do have another question that came in. It looks like for Dr. Marshall, Dr. Van Scoy, what efforts you have deployed for communicating the study results back to the communities? So yeah, what are those efforts looking like?
Yeah, that's a great question. So our website currently is host facing, meaning that we don't have any results yet of our project. But once we start to get once we finished our recruitment and started to get our analysis and our results, our plan is to convert our website to a community facing website that talks about what we learned, what we found, and sort of memorializes our project in addition to, of course, we're going to be doing research publications. We also have plans to create a community brief that we would mail out to all of our hosts that they can then distribute or print off PDFs. So that's all part of our year 5. We're still in year 2, so we don't have any results to disseminate quite yet, but we have intentional plans to do so once the results are available.
And we anxiously await those results as well.
So do we.
Yeah, we would like to see how that turned out. So that was a very good question. And once again, we understand that that's a process all in itself, is gathering the data and then making sure that it's correct before you disseminate it to the communities. But great question.
That is an excellent question. I think that was from Rahul Kashyap. So thank you for that wonderful question. Very important. So because of time, I'm going to keep going. At this point, I don't see any other questions, but if anybody does have questions that are unanswered today or think of it after the fact, you will have our contact information and are always welcome to send the cheer team any communications regarding any questions or concerns you might have, and we would happily forward those to Dr. Marshall or Dr. Van Scoy, who I'm sure would be more than happy to respond to those. So please keep that in mind. As far as upcoming cheer program, just want to make a few announcements real quick. There is a research lay ethics training program, and this is specifically designed for community partners. It's completely free. And again, it's about research it's research ethics, basically, for community partners who would be interested in becoming involved in community engaged research. It's called certification. So we will be hosting a workshop about that in December, the exact date to be determined. So we will let you all know about that. And then, as I mentioned before, we're actually going to do another workshop in the winter in 2023, in these next upcoming months, about overcoming barriers, which is kind of what we just started talking about with Dr. Marshall and Dr. Van Scoy, when we are engaging in these kind of partnerships with community academic research. So last but not least, I want to just kind of really quickly recap and ask for you all to kind of mention in the chat an answer to the question, how can community engaged research serve your community? So if you want to go ahead and answer that in the chat, we looked at so much today. First, we discussed what community engaged research, what it is, how we do it, why it's important. We then learned about our cheer program and discussed, how we can help facilitate partnerships between academic researchers and our communities. We then heard about an amazing community engaged research project between Dr. Van Scoy and Dr. Marshall and how it really benefited the community. And then you also all had an opportunity to discuss the challenges and the topics that are of interest to your community. So if you wouldn't mind, just go ahead and list real quick in the chat, how can community engaged research serve your community? We would love to hear from you as a kind of way to close this all up today before we end. So you can just pop an answer in this chat if you'd like that question. All right, wonderful. We're seeing some answers popping in now. Awesome. See, folks are typing away. And just as a reminder, everyone, we will be following up this session with an email with all of the documentation and all of the resources that were talked about today. They will all, as well as the slide deck and a recording of the actual workshop as well. Oh, I love this. This is great. All of the stuff coming in. Great. How community engaged research can serve the community. These are fantastic. Addressing needs, challenges in your community is fantastic. All right, everyone. Well, it is 12 o'clock. I don't want to hold anybody over, and we want to be respectful of your time. We can't thank you all enough for coming today. It has just been a wonderful session. Dr. Marshall, Dr. Van Scoy, thank you so much for taking your time, your valuable time to spend with us and talking about your amazing partnership. It's just a great example of what academic and community can do together and making important work happen. So we thank you so much, and we hope to see you all again soon.
Thank you so much for having us.